Okay, so Dr. Sharma says reliably and consistently it can be done. General Rick Hillier said, now again, this was granted before everybody had those smaller syringes. It was a real challenge. What is it?
Yeah, I think you have to have the right tools for the job. And if you don't have the right tools for the job, it might be a little more challenging. Sounds like they've ordered about 60 million of these syringes. We're expected to get 1 million in the country this week. And it just helps get that extra dose out. It's really interesting. You saw Saskatchewan reporting administering 106% of their allocated doses. The medical officer of health today mentioned that they were able to extract that sixth dose 100% of the time. So I think if you have the right tools for the job, you get that sixth dose.
Okay, health professionals will need to use these low volume syringes to extract the 6 doses. I hear there's a training element. We've all had our flu shots and 1,000 vaccines before. What kind of training do you need?
I mean, it's getting, I don't want to underplay it because it's still a skill. You still need to practice. You still need to do it. But like, it's a vial with a little bit of fluid in it. You stick the needle in and you suck it out. Like, that's really all there is to it. I'm not trying to undermine how incredible it is to get that 6th dose out. But like, I don't think it's going to take days and days and days of practice. It's just, anyone who's worked in healthcare who's done that before can probably do this.
The other thing, okay, so that's great news. Now, a lot of folks thought, oh gosh, Health Canada is going to approve the AstraZeneca vaccine from the UK today. It didn't happen. Maybe it happens this week. Fingers crossed if it does. But there's concerns that that is not effective against the South African variant of COVID-19, in which case, the cavalry comes over the hill, but they're using the wrong weapons. What's your take on how important AstraZeneca will be if indeed it's not that effective against this variant?
I think there's a few important points here. One is that clearly the variants of concern, including the one that was discovered in South Africa, are something we have to keep a close eye on. It's clear that the variant discovered in South Africa, the vaccines just don't seem to have the same degree of efficacy against that particular variant. However, when we look at the data, the AstraZeneca data comes from 2,000 otherwise healthy participants. I think it's really hard to make conclusive statements from that limited data. When we look at the other vaccines like Novavax, for example, and the Johnson & Johnson data, it's a little bit more robust, and it appears that while those 2 vaccines might not be as effective in preventing infection, they seem to reliably prevent more severe illness and death, which are obviously very important metrics, and they still had some efficacy preventing against infection. So I think whether AstraZeneca can do this or not, I'd say that that's still an unanswered question.